dream. The nightmare was still a dream.
Mic check 1 2. Mic check 1 2. 1 2 3 4 5 6 7 8 9 10. Mic check. Mic check 1 2. 1 2 3 4 5 6 7 8 9 10. Do we sound okay? Awesome. We'll be starting in just a minute, guys. What's up, Josh? Are you good? You all right? Mic check 1 2. Mic check 1 2 3 4 5 6 7 8 9 10.
Another one? Mic check 1 2 3 4 5 6 7 8 9 10. You good? Mic check 1 2 3 4 5 6 7 8 9 10. Everyone else good?
I bet you are. This has been intense. You're doing a great job. I feel very supported. I mean, we make the changes every day. So I know you got to be very, very, you just have to be nimble and, if it's not right, then you fix it the next day. So that's nice. Like, if it just didn't work, we pivot. Right.
Hi, Senator. How are you?
There's no money in it, so.
Today on my last day.
It does figure the first day that I bring a binder, there's a mic in the middle of the thing here.
I did catch.
Oh my God, the mayor has glasses.
Gray hair and glasses, what this job has bequeathed me. All right, we're gonna get started. So just so everyone, if you could, practice your social distancing, make sure you're not too close to anybody, wear your masks. I took my mask off to talk, I'll put it back on in a second. Welcome and good afternoon. I'd like to start, begin this conversation about testing with a moment of silence for the 109 residents of the city of Lawrence who have lost their lives to this vicious coronavirus. Thank you. Thanks to the governor, lieutenant governor for being here, Secretary Sutters, Deb Wilson from Lawrence General, John Silver from Greater Lawrence Family Health Center, Lynn Stouffer from Pawtucket, from Mass General Brigham, and the folks from Pawtucket Medical. Thank you all for being here today, all the partners. Senator Feingold, Representative Moran, Representative Minicucci, Representative Devers, thanks again for always helping out. I remember a little while ago, when the governor first ran for governor, I was helping his opponent. I was trying to beat him. And thank God he lost. Thank God she lost, because he's been great. Don't tell her I said that. She knows. He's been great, and the support that he's provided our community in times of crisis, this one is no different than the snow apocalypse, the gas crisis, and now this pandemic. The delegation's always been there to support us too, making sure we get every dime we can get from Beacon Hill. And so thank you all for all the work you guys do. Not since the Civil War have we seen this kind of national emergency that has caused very difficult decisions to be made daily. It's no surprise Lawrence has been a hot spot for this virus, and we've had community spread in our community since the beginning. Today we stand at 5th highest number of infected residents and 4th per capita. The state's numbers have leveled off and have been decreasing, but Lawrence cases keep growing. As of last night, we had 2,729 cases and have lost 109 residents to this awful virus. The actual number of residents, though, we know is higher than that. Something that this testing facility will help us clarify. For Lawrence, this virus has been a perfect storm. Lawrence residents are the workforce of the Merrimack Valley, and so many are continuing to work as essential workers. Some of them, most of them, are the most underpaid and the most vulnerable, and still they go to work in their essential jobs. Small and family businesses, along with gig economy workers, we have about 1,400 Uber drivers in Lawrence and taxi drivers, all these contract workers, have had to find shelter in the safety net of the unemployment insurance benefit. And as you can see on TV, and if you've seen on Facebook, the many, many food lines. Shutting down also costs the in-home and large daycares to displace those daycare workers in those businesses and the availability of that service to workers. And of course, I'm not sure we will ever begin to heal from the tragedy and losses of the nursing homes that has caused so much loss and death. So I was chosen by the governor to be one of the 17 people on the reopening committee and do that work, and thanks, Lieutenant Governor, for your leadership on that. We got a presentation from the Mass High Tech Council about how to plan to go back to work, and they showed us that a large variety of possible strategies exist to reduce the spread of the virus. Amongst them, you know them so a lot today: masks and face coverings, personal hygiene, and social distancing. Other things like ensuring we don't have large events, and so today I'm announcing an executive order with the Board of Health canceling all public events in the City of Lawrence, celebrations and parades through December 2020. Already, organizations like Semana Hispana, 4th of July fireworks, and the Feast of the Three Saints, who have been doing it almost 90 years, have canceled their events. In Lawrence, we've instituted a $300 fine for not wearing your mask, and yes, our police officers are out there patrolling for masks. We're utilizing all of these strategies, but still we need to do all the most effective strategies we can. Masks, personal hygiene, stay at home if you're sick, social distancing, but the best of all is testing and tracing. Contact tracing is one of the most important strategies in slowing the virus. We not only need to know who contracted the virus, but also who they've been in contact with. And you got to thank the governor and his team for the foresight to get Partners in Health started right away in creating such a broad and wide contact tracing program and leading nationally on the matter. And thanks our local partner in Greater Lawrence Family Health Center and their work to help Partners in Health. At this new testing that's behind us, with this new testing, we will be able to do both drastically increase testing and help in the contact tracing with the help of our community partners. The goal for the new facility is to do 1,000 tests for residents a day. If this crisis has shown us anything, it is the inequalities and disparities that exist across our society, in our health system, in employment, in childcare, and education. Opening a testing site like this one in a highly populated and low-income community is a major step to closing that gap. Inequalities, the gaps that create healthcare inequalities in these same communities. I appreciate the healthcare insurance companies for abiding by the Department of Insurance directives on lowering the costs and high rates of insurance reimbursement for this effort. Everyone is pitching in. We're urging all doctors who deal with Lawrence people to be liberal with their testing referrals. If a patient is calling you looking to be tested, you should test them. Provide them the referral. Send them to this site. Because the more data we can collect, the better equipped we will be to fight this virus. Again, we ask doctors to be very liberal with their referrals to the testing site. So part of this is that today I'm proud to announce that the City of Lawrence is going to invest $1 million to test 1,000 residents a day from our cash reserves. This is being paid for by the taxpayers of the City of Lawrence. To get an appointment, all you got to do is call the COVID-19 community screening line from Lawrence General Hospital. That number's right here, but it's also 978-946-8409. You will be checked for Lawrence addresses, IDs, as part of the process. Now, this investment comes in an uncertain time in our economic history. No one knows what budgets will bring in the fall, but we are facing a crisis of magnitude no one has seen in generations. But I feel that the City of Lawrence is in a strong enough financial state to be able to weather this storm. We were able to get out from under 10 years of state oversight last year by continuing submitting balanced budgets on time without use of one-time funds, having operating surpluses in 8 of the last 10 years, keeping property taxes low, having multiple bond rating upgrades, but most importantly, we have saved for multiple years $14, $15, $16 million in cash reserves. So I'm here to tell you that Lawrence is as prepared as any community can be to fight this war and heal after. And I'm just excited to get started testing. I'm going to say it in Spanish now, sorry. Buenas tardes. Me gustaría abrir con un momento de silencio. Nosotros pasamos por los 190 personas que murieron aquí en la ciudad de Lawrence por este virus. Quería reconocer al gobernador, la teniente gobernadora, la secretaria Sutters y los otros personas que están ayudando en este esfuerzo aquí en Lawrence. El senador Barry Feingold, el representante Frank Moran, el representante Cristina Minacucci y Marcos Devers. Ellos siempre nos están apoyando. Y el gobernador más que nadie nos han apoyado en tiempos de crisis, sea de nieve, sea de gas, sea de salud pública. No desde la guerra civil de los Estados Unidos hemos visto este tipo de emergencia nacional. Hay que tomar decisiones difíciles todos los días. Lawrence ha sido una zona caliente para el virus. Hemos tenido propagación comunitaria desde el principio de esta crisis. Lawrence hoy en día es quinto en mayor ciudad en el número de residentes infectados y cuarto en per cápita. Los números del estado han bajado, pero los casos en Lawrence siguen creciendo. Hasta anoche los números estaban en 2.729 casos y hemos perdido 109 residentes a la causa de este virus terrible. El número real de residentes con este virus no se sabe, puede ser 10 veces. Para Lawrence, este virus ha sido una tormenta perfecta. Los residentes de Lawrence son la fuerza de trabajo, los trabajadores realmente del Merrimack Valley, y ellos están trabajando como trabajadores esenciales hoy en día. Algunos de los más mal pagados y más vulnerables siguen trabajando en empresas esenciales hoy en día. Las empresas pequeñas y familiares, contratistas independientes, los hombres y mujeres que trabajan en Uber y taxistas han buscado refugio en la seguridad de los beneficios de desempleo y la línea de comida. Y no creo que nosotros podemos olvidar la tragedia del virus en hogares y edificios ancianos aquí en la ciudad que han muerto tanto y ha causado tanta pérdida. Cierre de los daycares grandes y pequeños de casas para trabajadores esenciales y desplazamiento de trabajadores en esos negocios grandes ha causado otros problemas. Como parte del trabajo en la reapertura de la Junta que el gobernador nos puso a ver cómo reabrir el Estado, nos dieron una presentación que dice que hay varias estrategias para ayudar a reducir el virus y que no siga creciendo en las comunidades. Entre ellos, ustedes saben unos cuantos: máscaras y cubiertas faciales, lavándose la mano, distanciamiento social y asegurando que si está enfermo se queden en su casa. Hoy estoy anunciando una orden ejecutiva también con la Junta de Salud que va a cancelar todos los eventos públicos, celebraciones y desfiles hasta el fin de diciembre el 2020. Ya las organizaciones como Semana Hispana, los fuegos artificiales del 4 de julio y la fiesta de los Tres Santos italianos también están cancelados. Fiestas que se han dado por 40 y 80 años. En Lawrence estamos instituyendo también la multa de $300 si no se ponen la máscara, y los policías están haciendo patrullas allá asegurando que todo el mundo se ponga la máscara. Estamos usando todas las estrategias. Aún así necesitamos hacer todas las estrategias más efectivas, y en eso vienen las pruebas. Las pruebas y los seguimientos de contactos. El seguimiento de los contactos es una de las estrategias más importantes para frenar el virus. No solo necesitamos saber quién ha contraído el virus, sino también identificar con quién esa persona ha tenido contacto. Agradezco al gobernador Baker y Partners in Health, y también aquí localmente el Greater Lawrence Family Health Center, con el liderazgo nacional realmente, con el plan para asegurar que buscamos todos los contactos con las personas que tienen el virus en el estado. En este nuevo sitio que está atrás de nosotros, de prueba, podremos hacer ambas cosas: aumentar las pruebas y darle seguimientos a las personas que han tenido contacto con las personas con el virus. El objetivo de esta nueva institución es hacer 1000 pruebas al día de residentes de la ciudad de Lawrence. Si esta crisis nos ha enseñado una cosa, son las desigualdades y disparidades que existen entre las personas en nuestra sociedad, en el sistema de salud pública, en el empleo y también en la educación. Abrir un sitio como esto de pruebas en un lugar como Lawrence, de alta población, de bajo ingreso, de tanta personas con virus, es bien importante combatir esas diferencias. Agradezco a las compañías de seguro que han bajado el costo de las pruebas y han ayudado a darle más dinero en regreso al hospital para poder hacer 1000 al día. Estamos todos, le damos a todos los médicos también de Lawrence que si te llama alguien de Lawrence, sé liberal con dar la referencia a la prueba. Asegurar que toda persona que lo llamen y dicen, yo creo que necesito una prueba, darle la receta para que ellos puedan buscar su prueba. Con mucho orgullo hoy yo anuncio la inversión de $1 millón de la ciudad de Lawrence para hacer 1000 residentes cada día con el dinero de nuestras reservas fiscales. Esto es pagado por las personas que pagan impuestos aquí en la ciudad de Lawrence. Para obtener una cita, nada más tiene que llamar a la línea que tuve aquí, 978-946-8409. Se verificarán con el ID para asegurar que tú eres una persona que vive en Lawrence. Yo sé que esta inversión viene en un momento incierto en nuestra economía y no se sabe qué viene con el dinero que viene en el futuro, pero necesitamos gastar el dinero en esta manera hoy para hacer la diferencia contra este virus. Estoy aquí para decirte que Lawrence está preparado como cualquier otra ciudad para luchar en esta guerra contra este virus y sanarnos después. Y estoy bien emocionado de que comiencen las pruebas ya al final. I know that was a lot, but I think it's important that we make sure that we communicate all this stuff into the right languages. I've had an opportunity to do this next thing a lot, mostly because he spends a lot of time in Lawrence. I hope it's not just because he lives in the North Shore. It makes it easier trip here. I think it's because he actually likes Lawrence and the people up here just a little bit more than everyone else in the Commonwealth. Don't tell nobody. But our governor has been doing great. And if I've had 3 crises in the snow apocalypse and the gas crisis and this, he's had it 100 times worse because he had to do it for the whole Commonwealth. And I think in an environment, he won't say it, but I'll say it, that the federal government hasn't been as helpful as it could have been. And so governors have had to find their own way. And I'm just happy that our governor is a policy nerd and a guy who cries when he thinks about how this stuff impacts people. My friend and our governor, Charlie Baker.
Thank you very much, Mayor, and I know I speak for the Lieutenant Governor and myself when I say how thrilled we are to be here today to participate in this announcement and in this partnership. I want to thank Representative Moran and Representative Minipucci, and I also want to thank Senator Feingold for being here. And I also want to give a shout out to the 2 chiefs, Vasquez and Moriarty. Where's the other one? Okay, those guys. Learn a lot about people when you're in the middle of a crisis, and we spent a lot of time with those 2 gentlemen and with the mayor and his team during the natural gas explosions up here a couple years ago. And well, you guys can have my back anytime. I also want to thank Deb Wilson for being here today, and for the folks from Greater Lawrence Family Community Health Center as well. I want to thank the team, the Mayor's Office, Lawrence General Hospital, and the Community Health Center for putting together this testing initiative. And I just want to say that for us, we have had an opportunity to collaborate with the hospital and with the Community Health Center on numerous occasions. The hospital, I think, got about a $17 million supplemental payment. As you work your way through this crisis, the Community Health Center got about $4.5 million. And I think you also got a rapid testing machine and 15,000 test kits this morning, which should help kick this thing off.
Thank you.
And I also want to thank the mayor once again for his support and his participation on the reopening advisory board. Lieutenant Governor made quite clear to me on a number of occasions that the mayor's participation, his insights, and his commitment to finding a path forward was enormously important to the success of that. I do want to give an update on our daily testing activities and on our hospitalization work. Yesterday, over 11,000 new tests were reported by the Department of Public Health in their daily report. That brings our total number of tests conducted across the Commonwealth to over 500,000. Around 9% of the tests reported yesterday came back positive. That continues a trend that's been at or below 10% now for a little over a week. I think we all remember that in the early and middle part of April, we were testing at around 20 or 30% positive in those tests. And as we've amped up and ramped up our testing, we've seen the percentage continue to decline, which is a good thing. With respect to our hospitalizations due to COVID-19, yesterday we had about 2,396 patients who were hospitalized due to COVID, and that represented a decrease of about 120 hospitalizations compared to the day before. That continues a trend that's had a few bumps along the way, but basically has been moving in a positive direction for about a month. And as we've said repeatedly, this public health data is the primary mechanism through which we can track how COVID is impacting our communities, and it also helps us make decisions with respect to how we move forward in reopening our economy. On Monday, we announced a new public-facing dashboard that had 6 indicators that we'll use to track positive performance with respect to managing COVID, trending positive or negative. And our hope is that as times go by, we can continue to slowly and carefully reopen different sectors, and that the dashboard will keep moving in the right direction. But as the mayor said, and as we've said on numerous occasions, how quickly that all happens in many respects is up to each of us, government, employers, and individuals. We all need to remember our role and the opportunity we have to fight against the virus. It starts with face coverings when you can't distance from others. It's also all about creating distance wherever you can. It's about keeping your hands washed frequently, using hand sanitizer, being vigilant with respect to your own symptoms or symptoms with others, and also making sure that you wash surfaces on a regular basis. The more we do of that, the more we bake that into the way we live our lives every single day, the harder we push back on the virus. And now with respect to the mayor's announcement. The partnership between the City of Lawrence and the healthcare partners in this community is a great example of how we can all work together to increase access to testing. The city's decision to invest $1 million and build out the capacity to test 1,000 Lawrence residents per day is a huge step forward to dramatically scaling up testing here in Lawrence. There's no doubt that COVID-19 has had a disproportionate impact on gateway cities like Lawrence. Many of these municipalities at one time or another have emerged as hotspots. And to support these communities statewide, we focused on partnering with our community health centers to ramp up their testing. Greater access to viral testing helps us better understand infection rates and who's infected with COVID-19, so we can support efforts to trace and help isolate and support people in isolation and reduce the spread. If you couple that with the other work that's being done by community health centers and local boards of health in conjunction with Partners in Health and with the Commonwealth, it's an army of folks working every single day to reach out to people who test positive and to reach out to their close contacts and do all we can to help support them as they isolate during that 14-day period. Now, since March, our testing capabilities have scaled up dramatically. 2 months ago, we were conducting a few hundred tests per day. By partnering with many of our private and commercial labs, like Quest and LabCorp and the Broad Institute, we significantly increased our testing capacity. And today we're consistently at or around 10,000 tests per day or above that, and we have the capacity to test up to 30,000 people per day. And to increase the number of people we're testing, we're focused on making testing much more available, something the mayor also talked about. We're grateful to many of the municipal and healthcare and other partners who are working with us to stand up testing sites across the Commonwealth. That includes the many community health centers that we're working with to increase testing in high-density communities. I also want to thank companies like CVS and Walmart who've launched and are expanding drive-through test operations across Massachusetts. All in, we now have a network of over 250 testing sites across Massachusetts. And a week ago, we announced a new website at mass.gov/COVID-test-map, which you can visit to find the testing site that's near you. The Department of Public Health has also expanded criteria on who can be tested. Now, anyone who's symptomatic or is identified as a close contact of a confirmed COVID-19 test case is eligible to be tested. That expanded criteria will also apply to the Lawrence residents who take advantage of this new testing site here in the city. Massachusetts, as I've said before, remains a top 5 player in per capita testing across the country, but we're committed to doing even more. On Monday, we announced our phased reopening plan for the Commonwealth. The plan will go slow and in phases and hinges on that public health data and those 6 key indicators I mentioned before to understand where the infections are and how our hospital system is holding up. Phase 1's underway, and we'll be in phase 1 for at least the 3 weeks we talked about when we announced it, and we'll continue to follow the data to determine whether or not we can move on to the second phase. That public health data is a critical driver, and we're also asking the federal government to help us continue to expand our testing capability statewide. In the coming days, we'll submit a plan to the federal government which will lay out our medium and long-term testing strategy. The plan will include assistance to boost overall capacity from 10 to 15,000 tests a day to 45,000 tests per day by the end of July and 75,000 tests per day by the end of December. That plan, if implemented, would make us the largest testing per capita entity in the world. It also involves expanding our lab space, expanding testing for high-risk settings like state hospitals, group homes, and correctional facilities, and also doing randomized testing for surveillance purposes and access to faster turnaround time for testing generally. And that report and that application will obviously be available when we file it next week. I want to close by saying that while testing is a valuable and critical tool in the fight against COVID, it is not, as the mayor and I both said before, the only one. People have a big role to play in this with respect to the behavior you exhibit and the behavior that you deliver every single day. Social distancing, hygiene, covering your nose and your mouth, and wiping surfaces clean frequently and as often as possible. And if you keep doing your part, we'll keep doing ours, and we'll get through this together. And with that, I'll turn it back over to the mayor.
So the testing is one piece of the recipe. I'm a fat kid, so I like to talk about cake. So it's the cake recipe. It's just one piece of it. So you wouldn't have a cake without eggs. So you have to do the testing and the masks and the hygiene and the distancing and the stay home if you're sick. That makes a nice cake. Otherwise, you have a coronavirus cake. No one wants to eat that. Nobody wants to eat that. The next person I want to bring up here, I should try to say that in Spanish. Es como una receta, realmente, como un bizcocho. Tú no vas a tener un bizcocho sin huevo. Sobre todo es una receta. La máscara, lavarte la mano, mantenerse a distancia de otra persona, quedarse en casa si está enfermo. Es una receta total. Si no hacemos una de todas esas recetas, va a salir mal el bizcocho. Nadie que come su bizcocho de coronavirus. Next up is a person who is in charge of our great hospital. It really is a world-class institution for Safety Net Hospital, and they do the best work that we could possibly expect from our hospital here for the residents of the city of Lawrence. Unfortunately for her, she just started, and they were like, hey, why don't you become the CEO? Oh, also, here's a pandemic. But she's been great at it. Our friend and our leader at the hospital, Deb Wilson.
Good afternoon, friends of Lawrence, Mayor Rivera, Secretary Sutters, Lieutenant Governor Polito, Senator Feingold, Representative Minicucci and Moran, and Secretary Sutters and Lieutenant Governor Polito, and the Governor. Thank you. On behalf of Lawrence General Hospital and our collaborators on this project, the Greater Lawrence Family Health Center, Pentucket Medical, Partners Healthcare, now known as Mass General Brigham, and Always Health, on behalf of all of us, Mayor, thank you so much for being the kind of leader who not only sees what the residents of the community need, but you're the type of leader that does absolutely everything to make that happen. From the first days of the pandemic, Mayor Rivera has been engaging with the hospital to try to tamp down the virus. He even held a press conference in March at the hospital, strongly urging people to stay home. Our entire community has been able to count on your leadership, Mayor Rivera, not only during the COVID-19 crisis we are facing today, but during the Columbia gas explosion crisis and every day. You've been Lawrence General's ally and the best kind of mayor whose compassion and forward thinking is saving lives and keeping our community safe. This testing site is a credit to your leadership. Thank you, Mayor Rivera. I would also like to thank Secretary Mary Lou Sutters for keeping the residents of Lawrence and all the patients that we care for at Lawrence General and public health at the forefront of your mind and focus. You have been at the other end of the phone advocating for testing equipment, supplies, and critical funding for us. And you do this every day. Thank you. And thank you, Lieutenant Governor Polito, for your exemplary leadership during this pandemic. And finally, thank you, Governor Baker. We so appreciate your statewide leadership and your coming to Lawrence to support this endeavor. We need and truly appreciate your continued leadership to see us through this pandemic. Thank you very much, Governor Baker. As you've all heard today, Lawrence has the 4th highest number of positive COVID cases per capita. Our goal in setting up this 9-lane drive-up COVID-19 testing center is to make testing readily available and accessible in our community so that we can stop community spread. To establish this testing center, a host of healthcare stakeholders came together. These organizations worked collaboratively with the hospital to operationalize this testing site so that it would be seamless for our patients and providers to get tested and get their lab results. I think it is fair to say that the teams from the hospital, the health center, Pentucket Medical, Mass General Brigham, and Always Health are very proud of what they've accomplished by coming together to bring something so meaningful to this community. Thank you, John Silva, Lynn Stouffer Malloy, Dr. Garrett Bomba, David Siegel, and all of your teams for pulling this off. I would like to give special recognition to a leader at Lawrence General who drove this undertaking over the past several weeks. Many thanks to Robin Hines, Senior VP of Strategic Operations, along with the wonderful team she worked with to make this happen. Dr. Ann Moran, Allie Scarry, Jess O'Neill, Missy Carroll, Layla Valinsky, and Rob Denise. A heartfelt thanks to these dedicated LGH team players. We did have stumbling blocks along the way, PPE and testing supplies, of course, but one major challenge was funding. When we told the mayor that Lawrence General Hospital can stand this up, but we can't do it alone, and we don't have the financial resources we need, the mayor stepped up, and the city of Lawrence, under the mayor's leadership, provided $1 million. Thank you, Mayor Rivera. The mayor and all of the collaborative partners came together and made this happen so quickly, and we're very proud of this testing site and the impact that it will have. This testing site will save lives, and it will allow our community and our hospital to get back to caring for some basic but also life-threatening health needs. I should mention that this pandemic has stretched the hospital's resources and capacity beyond words at times. More than 70% of our inpatient bed capacity has been dedicated to caring for COVID-19 positive inpatients. Each and every employee at LGH has played a significant role in fighting this pandemic. We have exceptional physicians, providers, nurses, and staff. We are also very fortunate to have an exceptional leadership team, including Dr. Eduardo Haddad, who has been right beside us every step of the way. Our Board of Trustees has also provided guidance and support through the entire crisis. A special thank you to our delegation for their unwavering support, Senator Barry Feingold, Representative Frank Moran, Christina Minacucci, and as well as Congresswoman Lori Trahan. We truly appreciate everything all of them have done for Lawrence General. And I would be remiss if I didn't thank Ellen Murphy-Meehan, our legislative advocate and staunch supporter of Lawrence General. She is amazing, and she shows her true passion for our hospital in this community every single day. It's been humbling and inspiring to see our medical community care for these sick patients, and at times it's been heartbreaking to witness the devastating impact of the coronavirus locally. Today we have a great story about a male in his 40s who was admitted with COVID-19, intubated, and treated in our ICU for almost a month. As he continued to recover, he was transitioned to a med-surg floor where he eventually tested negative for COVID-19. He was discharged to an LTAC yesterday after a 47-day length of stay. We are truly heartened by these patient stories, and that's why this Lawrence COVID-19 testing site is so important. Lawrence residents of all ages who have COVID symptoms and those who have been identified as exposed through contact tracing will obtain a doctor's order from their PCP and be scheduled for an appointment right here behind us. They will drive through, and nurses and staff from the hospital and Pentucket Medical Group will swab those patients, and within a few days the patient will get a call from the hospital or the health center with results. Our goal is to test 1,000 Lawrence residents a day and to stop the spread of this life-threatening virus and help our community return to living normal, healthy lives. Thank you all for coming together to help our community and Lawrence General fulfill its mission to care for residents of Lawrence and this region. Thank you.
Deb, thank you again for your leadership on this, by showing us it was possible, and then for bringing the staff together to make it happen. I think that your leadership in such a short time has had a huge impact. So thank you very much for all you do. So a lot of city staff were involved in this process, so I just want to make sure we call them out. I know the chief, the governor talked about our two chiefs, Chief Askin and Chief Moriarty. They do a great job every day. Captain Mike Armano from the Lawrence Fire Department, who's in charge of our special services and our public health, who are here with us today. Martha Velez, who leads our humanitarian effort every time. A veteran of the gas crisis, all of them. And Vilma Martinez Dominguez, who also is helping out with the homeless crisis in our city. All of them dropping what they do normally to make stand up all kinds of new things in this COVID-19 environment. And I just wanted a round of applause for the city staff that's involved in this every day. So how does a community that is has some of the poorest census tract in the Commonwealth save $14 million, $15 million, $16 million every year? We have a great state delegation. They make sure that we get at least $1 million a year for fighting crime and police officers in our community. And so I think it's just inappropriate to hear from our leaders from the state delegation, leading with my friend who used to play football against me. Well, he used to actually win. We used to lose. over at Andover High, my friend, Senator Barry Feingold.
Good afternoon. What a beautiful day. This is exactly why we put up with those cold winter days for days like this. You know, the city of Lawrence has so many resilient people and truly, truly amazing people. And we've been through so much. As the mayor mentioned, the gas disaster, and now this. And it also happens to be Memorial Day weekend. And yes, we have, with social distancing, barbecues, but it's also a weekend that we say thanks. We say thanks for those who have served and served our country. But I think this weekend especially that we need to thank a lot of people. And I first start with our medical providers, the way they've stepped up. Been amazing, the way they've stepped up. Thank you, Deb, thank you, John. And I'm not ashamed to say this, our political leaders. I want to thank Governor Baker, Lieutenant Governor Polito, Secretary Sutters. This is one of the hardest things that any elected official has ever had to deal with. And I think they've done a great job. And they deserve a round of applause. And having this testing today goes such a long way. And it truly matters. Because so many of those people that you're seeing on the front line, in our grocery stores, delivering our goods, are here right in the city of Lawrence. And that's why we need this testing here today. So it is a sunny day, and the sun is shining on all of us. So I do believe that the future is very bright here in the city of Lawrence, and the future is very bright here in the Commonwealth of Massachusetts. Thank you all very much. And I'd be remiss to thank this great mayor who has always been there through so many times. So I'm going to hand it back over to him, but I think he deserves another round of applause for the job that he's done as well.
I'm just afraid of all of you, so I make sure I try to do my best job as possible. I don't want you guys getting angry with me. The governor's been great, and Lieutenant Governor and her staff. Every time we call, they really are very supportive. But when the woman who's in charge of all health and human services from the Commonwealth gets put to be in charge of the task force to lead this fight against COVID-19, you think maybe if I call her, she might not have a minute to talk, or if I text her, she might not have a minute to return the text. But Mary Lou Sutters has not been that way. She has allayed a lot of my fears. I'm not a doctor, so I don't know. No one really knows about this stuff unless you're like in the medical field. And so she's allayed a lot of our fears and helped us every day. So again, I know people we're congratulating a lot of people, but every day she's got to wake up and figure out a way to beat this vicious virus. And I think she's doing a great job. A round of applause for our Secretary Sutters. Again, another Lawrence kid who's out there making sure that he beats the bushes for as much resources for our community. My former boss in the city council, my friend Frank Moran, Representative Frank Moran.
Thank you, Mr. Mayor. First of all, I want to thank the mayor for his leadership that he's shown over the past year and a half or 2 years. The mayor has gone above and beyond expectations, and he's like you said earlier, he's a Lawrence kid that really cares about our community. This pandemic has touched me very, very personally. I lost a brother of mine about a month ago, and I lost an uncle of mine about a month and a half, almost 2 months ago. So for me, this is personal. We need to make sure that we follow all the guidelines that are currently being provided out there. These people behind me are out there working day in and day out to make sure that we beat this pandemic, and also that we can out there make sure that we send the proper information to make sure that people out there are following this guideline. I want to thank the governor. I tell you, the governor has been on the forefront of this pandemic since day one, and I want to thank him again. Can you guys give him a round of applause, please? He was the first person when he heard about what I was going on, when my family was going on. I was the first person to send me a text that says, we're with you, friend. I want to make sure that you understand that we're doing the best we can of what we're doing here in this Commonwealth, and I want to thank you, Mr. Governor, for that. To me, that meant a lot. Again, my name is Frank Moran. I'm your state representative, and I really want to thank everybody that's involved in this. It's been very personal again, and I want to thank the Lieutenant Governor as well, Secretary Sutters as well, And Lawrence General Hospital, my God, seriously,
Woo!
I can't say enough of what they did while my brother was in that ICU for the past. He was there for 25 days, and my parents and I could not see him for 25 days. But I was able to get information from the staff that were able to sometimes even Zoom videos so I could see my brother. So I want to thank the staff of Lawrence General Hospital for everything that you do and for what you did for my brother and my family. Thank you. Again, thank you very much.
And Frank will tell you though, he spent while all that stuff was going on in his family, he was making sure that the elderly folks in our community were getting masks, and he was delivering boxes and boxes of face coverings for the elderly in our public housing and elder living facilities. So thank you, Frank, and we're with you. The newest member to our delegation, but not new to our community. Her and her family have been a big part of the building out of our communities across the Merrimack Valley. My friend and our state representative, Christina Minicucci. By the way, she also does the masks herself too. So.
Well, hi everyone. I don't do the masks myself, but I have an amazing group of women in this community who have been making masks like this beautiful one that I have here. They've been making them out of their homes for the past month, and about 500 or 600 of them have come to the city of Lawrence in the past week. So, but I am so excited to be here. I am the daughter of a nurse, of a Lawrence General Hospital nurse of 35 years. I have so much respect for everything for what nurses do every day, and what happens in this hospital here is an unbelievable feat. And sometimes I can't even imagine that they are able to pull off what they can pull off every day. So I am so thankful for Lawrence General to partnering with the mayor. The only way that we are going to stop this virus is if we can continue to test people, find out who has this as soon as possible, and help them protect their families. And that is the thing that I keep telling everybody over and over. As we're reopening, this is great, and we can start seeing some business opening a little bit, but it doesn't mean that we have to stop being vigilant. And having this testing site right here in Lawrence is going to make a huge difference in keeping the people of this city safe, and all the people who are working the front lines every day here in the hospital, but also providing food, and all of our Heart City workers who've been here keeping us safe. So thank you everybody for having us today. Thank you, Governor, Lieutenant Governor, the total rock star, Secretary Sutters, by the way, she's amazing. And thanks for everybody for being here.
So we'll take questions now.
Mayor, what's been the biggest challenge in the city, and also with Memorial Day coming up? Is it going to be sort of realistic to expect people will social distance at barbecues and that sort of thing?
So we're 6.7 square miles, and if you take up the roads and the river, we're probably more like 4.8 square miles. And so I think about how close we are to each other, that sometimes the social distancing isn't really possible. But that's why staying home if you're sick is important. That's why social hygiene is important. That's why we put such a serious emphasis on the masks. What we learned during the reopening committee research that provided for us was that testing and tracing can bring the R0 down 2.5 points, or 2.5 points. But a mask worn all the time by as many people as possible can move it like 1.7. So yeah, we're gonna do the testing and tracing, but the mask, if we put the mask involved, we will slow down the spread. So that's been a problem for us. The language issue. I think people who are immigrants in our community come here leaving really bad situations, and so they come here expecting better situations. So unfortunately, some of them have come during the gas crisis, and then also this. And so we're making sure that some of the poorest and the most needy amongst us get food. That has not been an issue. Thank God, the Boston Food Bank and places like that has made sure that we get the funding that we need. The governor's effort to do the Commonwealth Fund, that money has come to our community foundations. Those types of things have been very helpful. But again, not knowing everybody who has it has been the biggest stumbling block. Because if somebody has it, you can just tell them stay home and quarantine. But if they don't know, they're going to go to work. And again, we have the workforce of the Merrimack Valley. They're not going to work in downtown Lawrence. They're going to work in Tewksbury, to the Demoulas, the Market Basket warehouse. They're going to go in Newburyport to a restaurant. They're going to go to Lowell in a restaurant, or to deliver boxes in one of the other warehouses. So this testing was like the final notch of all things we did.
Can I ask Governor Baker a question, Governor, about Memorial Day weekend coming up? I know the planned state's beaches reopen Monday, and yet they're already very busy today, as you might imagine. What do you expect?
Well, first of all, I want to echo what the mayor said, which is that it's very important for us to respect the power of the contagion in this virus and to recognize and to understand that we have things we can do to prevent the spread. The biggest thing we can do is to wear a face covering if you can't keep distant from people. And you know, there's a lot of studies out there that show if two people are wearing a face covering, that takes 80% of the opportunity of that virus to move from one person to the next. Distancing, hugely important. Hand washing, sanitizing. These are things we can all do. We just have to do them and do them regularly. And my advice to everybody over the weekend, I would be the same advice I would give to my friends, I would give to my kids, I would give to my neighbors, which is respect the virus and understand that distancing and face coverings, if you can't stay distant, are your two greatest allies in preventing the spread. And the other thing I would say, and Lieutenant Governor and I have said this many times, one of the big things we've all learned about COVID-19 and about coronavirus generally over the course of the past 4 or 5 months is how many people can get it and give it to others and never know they had it. You know, back in January and February, people said, gee, there seems to be about a 3 to 5 day period of time here before people start showing symptoms. And then as you got from February into March, people started saying, well, you know, there actually may be some group of people, don't know how many, who are never going to show symptoms. And then as we got a little farther along, people started saying, based on the data and the research, that maybe as many as 20 to 40% of the people who get this never show symptoms. And that's why if you feel healthy and you feel good at this time in this Commonwealth, if you can't distance yourself, you should wear a face covering because you may in fact be a carrier. And a lot of people spend a bunch of time on Memorial Day weekend with family. Family usually means things like moms and dads, and in some cases, grandmas and grandpas. Wear a face covering, not only for yourself, but for the people you come in contact with. This is in many ways one of our greatest weapons in the fight against COVID. And wash your hands a lot, sanitize, keep the distance. Be careful. I mean, people have worked really hard and given up a tremendous amount over the course of the past 8 or 10 weeks to bend the trend on this, and we succeeded. And it's because of the work that everybody did that we're now here in a position where the mayor can serve on a reopening advisory board that's chaired by the lieutenant governor, but we can start talking about a gradual, careful, data-driven, phased reopening. Don't let a few nice days step on that. We need to continue to make the kind of progress that we've all made in battling this thing for the past 2 or 3 months.
Governor, Mayor Walsh yesterday said he didn't want people hanging at the beach. Are you willing to go that far? Would you say that?
I think if you're going to go out, be smart. Be careful and respect the virus. I mean, a lot of people in my neighborhood, I mean, I live a 5-minute walk from a beach. My wife and I walk our neighborhood all the time. It's one of the few things we've been allowed to do under the advisory. Sometimes we go down and we walk along the beach. But we keep our distance. And many times, most of the time, we wear face coverings. This is not about vanity, folks. It's about the safety and the health of your friends and your families. And it's about our ability as a Commonwealth to continue to move forward on a phased basis and make it possible for a lot of people who lost their jobs, many of whom live in communities like this through no fault of their own, to maybe have a chance to go back to work. There's a lot at stake here. Please be careful and respect the virus.
Will State Beach parking lots remain closed this weekend, and will they open Monday? Is that the way it works?
That's the plan, yeah.
This is a question for the mayor. Mayor, you mentioned testing referrals. What have you heard on that front? Are people having a
Listen, I think that the guidance the CDC has put out at the national level is the problem. They have, I think partly they won't say it is because they weren't prepared enough for how many tests they needed. So yeah, doctors were following CDC guidelines, and every time the CDC guideline could say, yeah, you can test more people, they're going to test more people. But I wanted to give an extra push to the doctors to say, be a little bit more liberal with it. I think that the people that were being tested were people who were really sick. So that meant somebody who was kind of sick was told to stay home and quarantine, just in case. But that's not, if you have a doctor tells you, well, just stay home and not get tested, and your only thing is to stay home or go to work, your job that you could lose, people are going to work. Not to mention the people who don't know they have it. So now you can say, well, my uncle had it, and we live with my uncle, can I get tested? That's a tracing person, so that person should go get tested. And then they'll know whether or not they have it, even though they don't show symptoms. But I think that there's a lot of talk about universal testing and who's doing. This is if you're a Lawrence person, and you're either got symptoms or you have come in contact with somebody who has symptoms through the tracing, you can come get a test. Is that everybody? That's not everybody. That's not universal. I have neither of those things, so I can't go get tested. But I think that at some point we're going to get to a point where you can get tests a little bit more widely. You can buy them, do them in your home, and all those things. Those are expected down the line, maybe next year, things like that. But we want the doctors to be clear about this. Just be liberal with it. We got the tests. Let's not have tests on the sidelines and not test people. And just to the point about the weekend, all you got to do is go through the obituaries of the newspapers. All you got to do is just look at the websites and the Facebook pages of the hospitals. You don't have to do Lawrence. You could do Lawrence General. You should do other ones. People are dying. We sent tons of kids to fight in Vietnam. 19 Lawrence boys lost their life in Vietnam. In this short period, we've lost 109 souls. The governor's right. We have to respect this virus. And you can drink with a mask on. You can just put the mask, take a drink, put the mask back on. Trust me, I'm gonna find my way to get my hands on a burger this weekend. Trust me, I will not be deterred. But I'm gonna have a mask. And my kids have been dying to have interactions with my father-in-law, who's an older person who we've got to basically isolate. And so everyone's doing their parts. And don't listen to these crazy people. Well, wearing a mask too is a problem. Trust me. The average, people, that's what people say to me. Listen, if you drink water to lose weight, that's a problem because you probably would drink too much water. I don't think I'll have that problem. The same thing with the mask. You will not have that problem. Wear the mask. You can save yourself and save other people. This is something very serious. 109 souls.
Governor, in regards to reopening things, I'm a frontline worker, obviously, but childcare, there's not enough emergency childcare. I can't find somebody to take my infant. I can only have 2 of my kids in daycare. And as we're moving forward and we're hearing rumors of 15 months and under not being allowed into daycares, who's going to watch my child? I'm kind of concerned. I called your office and I called the governor this morning just to kind of try to feel things out to see who I should contact and find out.
Yeah, listen, here's the real crappy answer to that. They don't know what this thing does to kids. They have no idea. Kids are dying in New York from the information stuff. During the conversations we had some real tough conversations. That was one of them in the reopening committee. And then I'll let the governor talk about it too. But they have no idea what this thing does to kids. And
I understand. I have kids at home that I'm risking.
and we too. So we got to figure out that piece of it, and then stand up more of the emergency daycare. I think in Lawrence, and maybe we should connect you with some of some of it's going unused. But it's a hard thing to do because it's not just a place you drop off your kid. It's a place where kids have interaction with professionals, intimate interactions with professionals, developmental interactions with professionals. And so how do we do it in a way that doesn't hurt the professionals, but also how do we do it in a way that doesn't risk the kids? We don't have any good answers, and I apologize for that because you're busting your hump every day out there. But at the very least we could do is try to get some more emergency space there.
Thank you.
So let me just add to that. First of all, thank you. I have a lot of friends in the healthcare world, and really tough conversations with him over the course of the past few months. I mean, I'm an older guy, so most of my friends in the healthcare world have been in the space for a long time. And, you know, they thought they'd seen it all until they saw this and experienced this and dealt with this. And honestly, I know the media's tried really hard to help people understand what it's like to have 70% of your hospital turned into managing COVID-19 patients. But it's like nothing many of my friends have ever seen. And a lot of them are ER docs, and they've been at this game a long time. So to you and to all your colleagues, I can just say God bless and thank you. And on the child care piece, the Lieutenant Governor and I, and Secretary Sutters, and Commissioner Sam of the Early Education and Care Agency have all been working this one hard. We know that we need additional capacity, and we know it has to be done in a way that is safe, or at least very safe. And we expect that we're going to have guidance on this shortly. But I've had a lot of people say to us, how come you didn't have this ready, yesterday? And my answer was, this is one of those things we want to get right. And your concern about more is very much top of mind for us. And we've heard that from a lot of people. And we do have 6,500 available slots in our existing emergency system, but they're not all where they need to be for people who are looking for them. And we get that. And we also understand the mayor's point, which for some people, there's a particular provider who they trust and they believe in, and what they want is that provider to determine whether or not they can operate under a new set of guidance. And we're hoping and anticipating we'll have something we can share with the community pretty soon.
Last question.
And I hope you get some time off this weekend.
Governor, do you envision how, if people don't respect the virus at the beaches on Monday, do you envision having to shut those down again?
One of the things that I think the Lieutenant Governor and I have been most impressed with and grateful for is that people in Massachusetts, the overwhelming number of people in Massachusetts have been really good about abiding by the guidance or the advisories or whatever it is that we've put out or our colleagues in local government have put out. And honestly, I'm sure that over the course of the weekend there will be some places where people don't behave and live up to the terms of the advisories and some of this other stuff. But I believe that the vast majority of people will, because for the past 2.5 months, the vast majority of the people in Massachusetts have, day after day, done things they've never done before to put up with and fight against this virus and to join together to defeat it. So I expect that people will do the right thing. And I'll say one more thing about this. It's Memorial Day weekend. There are a lot of people who died for your right to live in a free democracy here in the United States, here in Massachusetts. Those people stood up, put on a uniform, most of them volunteered, and marched directly into the field and the theater of combat. And Memorial Day is when we celebrate the ones who didn't make it home and their families. You don't want to wear a mask because you don't like wearing a mask. You don't want to social distance because you don't want to social distance. Please think about those families, those moms and dads, those brothers and sisters, those sons and daughters of those who lost their lives fighting for your freedom. Put on that mask and just do it for them. Socially distant for them. Wash your hands for them. Because if they were here, they would be doing the same thing. Thank you.
Thanks, everybody.
Thank you.
Hey, just real quick, just a little housekeeping. If John Silva and Lynn Stoffel, can you raise your hands? I just want to make sure people know where you are. These are our partners that didn't get to speak, but if you want to interview them, they're right there. Lynn, and I saw John around here, John Silva. And just a message for folks at home, please stay home. If you're sick, wash your hands, wear your face covering. Quédese en su casa, usa una máscara, lávense la mano, and we'll all be better. Thank you so much.
Really nice job, Mayor. Thank you.
That high school thing, I really did want to do that.